Chronic axial spinal pain is a widespread issue affecting millions worldwide, often leading to significant discomfort and reduced quality of life. This type of pain, which can originate from the cervical or lumbar regions of the spine, is commonly managed with procedures like medial branch blocks (MBB) and radiofrequency ablation (RFA). These interventions target the nerves responsible for transmitting pain signals from the facet joints, aiming to provide relief for those suffering from persistent back or neck pain. But beyond pain relief, there's an important question. Do these procedures impact a person's ability to maintain balance? In this video, we'll explore the latest research examining the relationship between spinal pain, nerve interventions, and postural stability. Balance is a complex process that involves the integration of sensory information from the visual, vestibular, and proprioceptive systems. For individuals with chronic spinal pain, maintaining balance can be particularly challenging. The nerves targeted by MBB and RFA not only transmit pain but also play a role in proprioception, the body's sense of position and movement. Disruption of these nerves could theoretically affect stability, increasing the risk of falls or postural instability. Understanding how these procedures influence balance is crucial for both patients and clinicians, as it helps inform treatment decisions and safety considerations. To investigate these questions, researchers conducted a quasi-experimental study involving 61 adults with chronic axial spinal pain and 60 age and gender-matched healthy controls. Participants were recruited from a multidisciplinary pain clinic and underwent either cervical or lumbar MBB RFA procedures. Exclusion criteria ensured that individuals with pre-existing balance or vestibular disorders were not included, allowing for a clearer assessment of the procedure's effects. Both groups completed standardized balance assessments before and after the interventions, providing valuable data on postural control and sensory integration. Balance was quantitatively measured using the PROTXX vibrata sensor, a head-mounted device that records subtle movements and postural sway. Participants performed static balance tests with both eyes open and closed, while the sensor captured data across multiple frequency bands. These bands correspond to different sensory systems: visual, vestibular, proprioceptive, and central nervous system integration. By analyzing these data, researchers could determine not only overall balance performance but also how different sensory inputs contributed to maintaining stability. The study found that individuals with chronic axial spinal pain, especially those with facet joint pain, exhibited greater postural sway, an indicator of reduced balance compared to healthy controls. This difference was most pronounced when participants stood with their eyes closed, highlighting the importance of proprioceptive input in maintaining stability. Interestingly, those who experienced significant pain relief greater or equal to 50% after MBB RFA still showed balance deficits, suggesting that pain reduction alone does not immediately restore normal balance function. Notable finding was the increased postural sway observed in participants who underwent procedures at the C2-3 level of the cervical spine. This area is closely linked to head and neck proprioception, and its denervation can lead to ataxia or impaired postural control. In contrast, procedures at other cervical or lumbar levels did not result in significant new balance deficits. This suggests that while most patients can safely undergo MBB RFA without major balance concerns, special attention is needed for interventions at C2/3. Body's ability to adapt to changes in sensory input, known as sensory reweighting, was evident in the study. Participants who responded to MBB RFA with significant pain relief showed a trend toward relying less on proprioceptive input and more on vestibular cues to maintain balance. This adaptation helps explain why overall balance performance did not worsen significantly after the procedures, except at C2-3. It also underscores the body's remarkable capacity to compensate for altered sensory feedback, especially in chronic pain conditions. From a clinical perspective, these findings are reassuring for most patients considering MBB or RFA for axial spinal pain. The risk of developing new or significant balance impairments after these procedures is low, except for those involving the C2-3 region. For patients with pre-existing balance deficits, however, the procedures did not improve stability, highlighting the need for targeted rehabilitation. Clinicians can use this information to better counsel patients about the risks and expected outcomes of nerve interventions for spinal pain. Summary: the study provides valuable insights into the relationship between chronic axial spinal pain, nerve interventions, and balance. While MBB and RFA are effective for pain management, their impact on balance is generally minimal, except for procedures at the C2-3 level. The findings highlight the importance of comprehensive assessment and individualized care for patients with spinal pain. Future research should explore dynamic balance, gait, and the effects of rehabilitation strategies to further enhance patient outcomes.